Hello, everybody. So let's jump right into chapter 5. Let me pull that up. Share my screen with you. Don't have videos for you to watch tonight, but we'll soon. All right, chapter 5, the physical environment and safety standards. So now we're looking at how the OR is set up, looking at the furniture, the safetiness, everything, including things that you will be watching for and things that you may be exposed to. So after studying this chapter, you'll be able to recognize the hazards that are going to affect the patient in the operating environment, distinguish among the support services that work with the OR team in the care of the patient, review the type of air handling system that are required in the OR and the temperature and humidity required to maintain a sterile field. Indicate cleaning procedures, traffic patterns, and routines required in the operative environment. Analyze the role of your position in the protection of yourself, of your patients, and of others from hazards in the operative environment. And then there's different design types of the OR we'll look at. And then, of course, there's different hospital departments that relate to surgical services we'll look at a little bit. And then the working environment and the physical components of the OR. So the surgical department is it's basically its own world. Other departments are not free to enter that department as freely as many other departments in the hospital setting. Sorry, pups are a little bit active. But the surgical department staff does have easy access to the other departments. It's just that other departments doesn't have as easy access to the surgical department. It is a little more protected and a little more secure for various reasons, of course. Very limited traffic in and out of the surgical department. And this is just to cut down on the amount of contaminants that are entering that environment as a whole. There is no access for the general public. So this is something that really does help cut down on the contaminant environment and control. So there's several different design types, and you'll see those in your textbook. There's the racetrack, the hotel design, and specialty, and I'll show you some of those pictures. The design, it really does help on this environmental control as far as controlling the amount of contaminants that are allowed into an area. But traffic control is really important in this as well, because remember, the circulator is your person that's going to be able to leave the OR and go to be able to access other equipment and supplies. And there's very little traffic outside of the OR during cases, and that is to help with that contaminant reduction. So desire to prevent surgical site infection, that's a big part of what the design is based around, is that surgical site. So always remembering the surgical site protection is your #1 goal, protecting it from contaminants and any kind of infection risk. So let's look at some of those. This is what's called the racetrack, and it's not a really full picture of it. I can look and see if there's a better one in the book. I didn't look in the book for this, but this would be considered the racetrack, where it's in kind of an oval shape with multiple ORs along the perimeter. Usually you'll see like a nurses and doctors station in the center of the track, where they have access to it, as well as additional supply rooms in the center hallway. And so this is something that all the circulators can have quick access to for those additional supplies that may be needed, whether it's gowns, gloves, sutures, you know, a lot of those more common items that will need to be retrieved and brought back into the OR on a, you know, in a real timely manner, so they're not having to go all the way to central sterile or to the supply room, I should say, to get those supplies. So just kind of a real general supply room in the center there. So that's the racetrack design. This is more of the hotel design, where you have a primary corridor down the center and with rooms going off of each side of that. So you can see here you've got ORs on either side with a substerile and a scrub room in the center area for preparation into the OR. And you can see at the end of the hallway, there is equipment and supplies, and that's kind of taken the place of this center aisle area where there's extra supplies. In the hotel design, you'll see it at the end of the hallway, usually for that quick retrieval. So I didn't have one for specialty. In my opinion, the specialty design, it kind of looks like a dentist office where there's not necessarily, it doesn't look like an OR as much as it looks like more of a dentist office or a vision office, where it's, you know, there's very specialized tables, OR tables and equipment in the room. And the rooms are usually smaller because it's not a massive OR, you know, where you're needing large equipment in there. This is kind of the typical layout of an OR. There's a lot of different designs of OR layouts. This one, as you can see, looks like an ortho. Patient has on a boot with traction. Back table is over here because this is going to be surgical site more than likely. Or I'm not really even sure what this one is. Oh, the C-arm is right here. So this may be like a hip. So here is the surgeon station. So the traction is going to be pulling in the inferior direction on this one. So we may be looking at some type of a hip replacement. And you can see the back table is over here against the wall, out of the way, with the tech being right here by the surgeon. Mayo stand over the head of the patient, just for quick retrieval of those most commonly used pieces of equipment. The C-arm on the opposite side, extending all the way under the table, and that allows for the fluoroscopy to occur so that the surgeon is always able to view what is going on through the x-ray. C-arm monitor would be here for the quick view from the surgeon, assistant across the table. Circulator will be circulating all around, and tower monitor here for monitoring of multiple things. The ESU will be plugged in there, suction be plugged in there. You know, all of the connections will be making contact in this tower monitor. Anesthesia at the head of the table. So there's some areas of the operating room we want to talk about. So unrestricted, there's no restrictions around this area. So this would be including patient registration and pre-op holding area. This is where the patient and the family will enter on arrival at the facility, and then the patient will continue alone into a pre-op room. Now, there's many facilities that allow a small number of the family, possibly 1 to 2 visitors in with them in pre-op until they're waiting their turn to go back. And a lot of that reason is because it is stressful. They can be anxious and nervous. And so having a family member with them really does help reduce that. Now, that is pre-op. Now, before, in the past, the PACU used to just be called the recovery room. Now it's called PACU, and that stands for Post Anesthesia Care Unit, AKA it's the recovery room. And so this is where the patients are usually transported to immediately on leaving surgery. And that is where the staff is going to care for the patient, make sure that they're fully recovering from anesthesia, that their pain is under control before they're allowed to move out to the area where the family can then visit with them. Other areas that are unrestricted in and around the OR are the laboratory, radiology, and pathology. And so these are departments that are away from the OR, but they have quick access to the OR. Sometimes ORs will even have like smaller access for pathology to be even in the OR room and to have equipment as well. So that, of course, is going to be restricted, but the pathology department, radiology department, and laboratory department, they are outside of the OR. Semi-restricted OR attire is required. And so that means your shoe covers, your hair covers are going to be required, your scrubs at that point. So this, you have entered into the surgical department. So that is why your surgical attire is always required back in that area. There is a storage room for non-surgical instruments, equipment, and supplies as well. And then there's assembly rooms and decontamination rooms. So this is where your case cart system is going to be located, where you're picking up your cart, then you'll go to the storage unit or storage room, and you will gather all your supplies, load them into your case cart, if that is part of your job. Sometimes case carts are already pulled, just depending on the size of the facility. Sometimes central sterile will be pulling those carts, or surgical staff will be pulling those carts. And then at other facilities, you're pulling your own. Central supply and processing department. So this is, we've watched these videos. This is where they're cleaning the instruments, and where they do the sterilization after that final wrapping of the instrument sets. So all of those are semi-restricted. So again, not accessible by the general public. Here is a case cart. You can see here is instrument trays. These would be equipment packs. So you'll find all of these inside these stainless steel case carts. Easy to roll with a handle, room on top to add additional items as needed as well. And these all go back into the central sterile department contamination area upon completion of the case. And now there's a restricted area of the OR, and the first part of that is the substerile room. And this is kind of like a work room. The rooms are adjacent, so you can see where your scrubbing and where your substerile room are. They're usually adjacent to each other. And I apologize, somebody's doing their lawn across the street. There's usually a sink, steam sterilizer in there, blankets, because these are often needed, especially as soon as the case is over, to help reduce the risk of shock as the patient's temperature begins to shift. And this substerile room may definitely be used in emergent situations where there's extra blankets needed, needing to steam sterilize something quickly. It can be a small storage area, and those doors are usually they're always going to be closed during the operation itself. Environmental services is the staff that provides the cleaning services. So in between cases, they will be cleaning the surgery department. And so this is where you're helping prepare the room for the next case in that turnover. And then environmental services will come in and do their job of cleaning the surfaces of the whole surgery department of each room and the department as a whole. And then I'm going to jump over to the book real quick. Let me stop the share and go find that. have it pulled up. Okay. Let me go find that. It was figure 5.2. Let me get to 5.2 because I want to show you. I want to make sure that we're covering everything in the book that you need for this learning experience. Lots of pictures in this chapter, which I like, of course. So share that screen again with you. So this figure 5.2 is your operating room. Here you can see there's back table. There's going to be a ring stand. Here is your Mayo stand, OR table. Here's anesthesia's tower. Here's cabinet. This is a door. These are cabinets. This is where circulators going to be working primarily. You can see the lights and the booms from the ceiling. There's your radio. That's super important in an OR. So, oops, wrong way. Okay. So this is where the procedures are performed. Now, a lot of the equipment that's in the OR, of course, you're going to have a lot of electrical and suction outlets. I'm going to show you some of those. Suction outlets and electrical both. Those outlets are placed midway on the wall so that they're clear of any flooding, any contaminants from body fluids during a procedure. So they're up at about halfway up the wall, as well as in the ceiling. And so a lot of times those outlets will be utilized during cases from the ceiling and always from the wall. So that's a very common thing that you'll see. Gas outlets and lights, of course, your lights are hanging from the ceiling as you saw in the picture. And as we have in our lab, gas outlets are typically at the head around anesthesia's area. So these are going to be multiple different types of gas. You'll have oxygen, nitrous oxide, and compressed medical air. That is filtered air that will be used for various reasons. You also have air exchange in the OR, and this is to keep the contaminants reduced, as well as any dust and keep temperature regulated as well, and the humidity, because all of these are going to play roles in the safety, and we'll get into that in just a moment. So the environmental control is very important in an OR where you have circulating air that is continuously filtering the air. HEPA filters are always used in the ORs as well. And then as we saw, we'll have cabinets, doors, computers. There will be X-ray viewing boxes available for the surgeons to view what's going on. And then, like I mentioned, the booms. So boom is, it's basically where the equipment is on an arm that extends from the ceiling, and that allows the staff to move that around to a more efficient area. So it's not something that's on the floor having to roll around and cross over cords and things of that nature. It's extending from the ceiling and able to move around. I think I've got some pictures of that. Then just standard operating room furniture. And remember, part of your role as a scrub tech is helping to rearrange the furniture before and after each case in preparation for the next case. So here you have the operating table. You're familiar with what a back table, Mayo stand, and ring stand looks like, so I didn't include those. And then, of course, here is your kick bucket. And the reason for it being a kick bucket, of course, is so that you can move it around with your foot very easily and to be able to place it in the position that it's needed without any kind of contamination risk. Linen hampers, you guys are familiar with those, and trash containers. Here are suction sets that you can see are attached to a wall. So this is your wall vacuum that we talked about. And so your suction tubing, your yonker attached to that suction tubing will attach at this area, and that will allow all of those fluids and secretions to go into this canister. And it is a measured canister that allows anesthesia to monitor that output for body fluid balance, because they're managing how much fluid you are entering into the site via irrigation and how much is coming out through suction. And that also helps them count blood loss as well. And then there can be miscellaneous things around the room as needed. And we'll go over some of those. And then another hazard that we always want to be watching for is the ionizing radiation. So, you know, we're going to be using radiation a lot in an OR, especially if fluoroscopy is being used with that C-arm, where the surgeon is having to look at what they're doing as they're moving through the procedure. It has very therapeutic effects, but it also can have some harmful effects. It's used a lot in cancer treatments, and the reason that it's used for that is because it changes the cell membrane. It also changes the enzymes, the proteins, and the genetic material that lead to cancer. So it's really important that you are protecting yourself in these cases, because while it is providing the therapeutic benefit to the patient, it can provide harmful benefit to the staff as well as to the patient if things are not safeguarded. And so this is one time to think about it when radiation is being administered in the OR setting directly to the cancerous area. X-rays are going to be used a lot during an intraoperative case. So you're going to want to take those measures. You have to follow all of the guidelines of ANCI, CDC, NEOSH, OSHA, and JCO. So all of those protection mechanisms that you're going to use, one, you're going to make sure that the lead aprons are being used to shield the patient's body in the area that the radiation is not being administered. Anytime that the X-ray is not needed, that the fluoroscopy is not needed, then the fluoroscopy scope should be turned off when it's not being used, so it's not continuously emitting that radiation. Covering the patient's thyroid and reproductive areas with lead shields. They're made specifically for those areas. The shape of them is perfect for those areas to provide the broad range of protection that is needed. Now, for yourself, you may find that in cases where radiation is being administered, you will also be probably wearing a lead apron. Be prepared for those because they are heavy and hot. And so you have to prepare for the carrying of that weight during the procedure. They are fairly comfortable though, so you don't have to worry about that discomfort. It's just about getting used to that excess weight and the heat that can come from them. And that's, you know, a lot of this goes back to why ORs are so cold. One, you're in a lot of clothing, and it also helps with the contaminants of bacteria and such with the temperature. So, but it does help when you're wearing a lead apron to be in a room that is cooler. With protecting of yourself, it's about time. So it's about how much time is the ionizing radiation being administered. Are you shielding? Are you staying a fair distance away from the radiation emission machine? So just keeping all of that in mind while you're in these cases. Now they're very conscious of these protection measures during these cases. So it's really about just following what is requested of you and recommended by the senior staff, because they're very much about protecting you as an employee, but you want to make sure that you're taking all those precautionary measures. And I remember years ago working with staff that would say, I don't plan on having any kids, I don't need an apron. Well, that wasn't the only area that was going to be affected in a negative way. So, that's a risk that you don't want to take. Now let's move into electrical hazards. So there's a lot of use of electrical equipment in the OR. And because of this, then it's increased the risk of electrical hazards as well. Now, there are manufacturer instructions on all of these electrical equipments that you want to make sure that you're following. So a big one is grounding. That's critical on your electrical current. Here in this picture in the lower right corner, I've got a picture of an ESU grounding pad. So you can see here, the lowest one from the grounding pad on the patient's thigh. The electrode is a negative electrode that's then going towards the ESU. And so this is the ESU unit that then transmit a positive electrode into the bipolar end. So this is a circuit that has to always be grounded so that it is closing that loop. So you want to make sure that the grounding pad is always securely attached to the patient. Now, electrical burns, this can happen from a couple different sources. Of course, your ESU pin is an easy way to cause an electrical fire. And so that is why your Bovie container, so that plastic case, it is always going to be attached to the drape so that when it's not in use, that Bovie pin is dropped back in that case so that there's no risk of accidental activation. And because that Bovie pin can quickly start a fire when it makes contact with the drapes, okay? So if you remember how those drapes feel, they're like paper and plastic kind of all embedded into one. Quick way to start a fire. So that is why that it's important that your Bovie case is really handy for the surgeon to just drop that Bovie pin back in that case. The electrode and patient placement consideration. So this is important to make sure that when you're placing any electrodes on the patient, that they're out of the way of the drapes, that there's no static charge that could occur from that. So, and there's going to be a lot of electrodes placed on the patient. And so they're going to be as much away from those ESUs as possible. Common locations on or in the patient, one for a fire is the airway. And you have to think about the amount of compressed oxygen and air that is going through the airway during a case. And so that's a really large risk there. The face is another one, and elsewhere as well. I'm going to switch back over to the book really quick because I'm going to show you this fire triangle I want to talk about. There's all the suction canisters that it shows in your book. Get down to there's your surgical lights. Let me make this page a little bit bigger for us. There's the old people. There's the fire triangle. So in this fire triangle, we're looking at, here is the ignition sources. So you've got your ESU unit, lasers. Lasers are a really easy way to start a fire as well. Any electrical equipment that could be faulty could be a strong risk for starting a fire. And then we have a lot of fuel in that OR. So we've got patient's hair. That's why the face is a big area of fire risk. Those drapes that I talked about, that plastic and paper wrapped up into one, it's a really easy starter or fuel. Then the non-metal airway, and then those prep solutions, because there's a lot of alcohol in those. And so those are some very easy fuel sources. It's also a really oxygen-rich environment. We've got both oxygen and nitrogen in the ORs. And so these are the three components of fire. And you've got all of those in the OR. So you've got to be very careful in making sure that you're taking all the precautions that you can. Yeah, we talked all about all that. There's also 3 types of fire extinguishers. So there's class A, B, and C. So A has water in it. Those are for like solid materials like wood, paper, textiles, things like that. B is a powder inside that extinguisher. And so that's for like anything flammable, liquids, gas, that water and gas doesn't mix in that way, and flammable liquids as well. So that's why the B extinguishers have a powder component inside that they're going to help to extinguish the fire. Now C is a halon extinguisher. So this is for electrical or laser fires. And you'll have those in the OR readily available for you. And in the event that you're ever in a fire, you always want to remember the mnemonic pass. So you're going to pull the pin at the top of the extinguisher. You're going to aim the nozzle toward the base of it, not the top of it, but the base where it's actually the fire is coming from. Squeeze the handle and then sweep the nozzle in a back and forth motion. And so that's a very effective way to quickly extinguish a fire. So pull the pin, aim, squeeze, sweep. And then in the event that a fire should occur, your number 1 concern is going to be your patient. You're going to contain the fire if possible at all, moving anesthesia equipment far away because it is all gas-based. And then you're going to use the acronym of RACE: remove and rescue the patient, alert the sound or sound the alarm, contain the fire, and extinguish or evacuate. So whichever is needed in those cases. Now, we talked a little bit about laser, but those fire hazards are real, especially when you're looking at cases that are a full laser case. When it is a laser procedure, you'll see this picture down here in the right-hand corner that I've got, where that danger laser in use sign is going to be always displayed. And this is really important that you recognize this sign, because this tells you there's going to be laser used, so you must wear your protective eyewear, because this is really important that you wear that to help with the retinal damage risk being reduced, as well as in laser cases, as well as big ESU use cases. There's that surgical plume, and you want to make sure that high filtration masks are being used in these cases, because you don't want to inhale that surgical plume. It does have contaminants in there. And then, you know, you're going to take extra precautions in these cases to prevent fires, and especially when lasers are used in the head and neck area, because you're very close then to the airway, to the face, and the hair. And I'm not sure if it talks about it in this PowerPoint, but I know that when you're looking at how cases are done a little bit differently in laser cases, one, anesthesia is going to use a non-explosive anesthesia agent, as well as the endotracheal tube is going to be of a little bit different material, so it's not as flammable, as well as the balloon. So normally, you know, when an ET tube is inserted, it is secured with air being injected into that balloon at the end of it. Well, in laser cases, it's actually injected with sterile water. And in all of these cases, you know, in laser, you're going to have that class C fire extinguisher, you know, where you know quickly where it's at. But in general cases, you can use sterile water. In the case where you would use an A extinguisher, you can use sterile water from your back table in the place of that class A extinguisher for a quick access to water. But with the laser fires, you're using that halon class C. Let's talk a little bit about ergonomics. So, you know, you're going to be standing for long periods of time. You're going to be in one position. So proper posture and body mechanics is really important to reduce long-term back injuries or pain factors. You know, some things that may make you a little more susceptible to injuries, obesity, jerking or twisting your hips. So you want to make sure that your movements are, that you're thinking about your movements. If you notice that your flexibility is decreased, you're losing some of your strength, you may be at more risk, very much so improper bending, lifting, and reaching. So are going to put you at more risk. So you want to maintain really good body mechanics. There is I think it's the Association of Advancement in Medical Equipment and Medical Instrumentation. That's it. They have an ergonomics section in there, so you can use those guidelines during a daily routine. So they do have some recommendations to help you know the best ways to move in those situations. Now, the lights in the OR, they're non-glaring. They're hanging from the ceiling so that it can be adapted to the direction that the surgeon needs for the best viewing, as well so that they're not causing interference with the decided to go for a leap, and I think I better plug it in because that's where my PowerPoint is at. So access to that. Noise is kept to a minimum in the OR with the exception of music. And so the doctors are very particular about what type of music that they need while they're operating. But then as far as like OR chat, that's going to depend on the surgeon and their level of comfort with noise. OR doors are always kept closed to keep that contaminant low. And here, music may be appropriate, but not distracting. And that totally depends on the surgeon. Some surgeons want music that, in my opinion, would be distracting. So environmental, so we have those overhead surgical lights, booms, cords, tubing, foot pedals, rolling stools. All these things are put in place to help keep things safe. So cords and tubings, your circulator is going to be securing those. Foot pedals are used underneath so that there are ways to activate the ESU. Rolling stools, so these are for those procedures where the physician is needing to sit. Standard precautions, so these are your typical precautions that you're taking that are defined by the CDC. It applies to all blood and body fluid secretions and excretions. You're doing this on a regular basis as far as making sure you are in your scrubs, foot covers, hair covers, gowns and gloves, mask, and eye covers. So these standard precautions are very important. And we'll get into PPE just a little bit more in a moment. Talking about latex, we know that there's two types of allergic responses to latex. There is a type 1 and a type 4. Now, type 4 is more of just a body rash. So it's like a contact dermatitis. You wear gloves and then you have a little bit of a rash on your hands. That's a type 4. Type 1 is more concerning and dangerous. This is where IgE is activated and it could cause an anaphylactic response. So high risk patients and providers should be tested. Patients that are high risk latex allergy, they're going to be scheduled in the OR in the first procedure of the day. Let me jump over to the book because there was a really good description of all of that. So, and that is because, latex dust, it is easy to be dispersed into the air. And so with the cases being the first case of the day, then that risk is significantly lower. So with type 4, we're looking at irritant contact dermatitis or allergic contact dermatitis. So here we've got red, raw, cracking skin. That's the most common reaction. And then that's just the irritant, from the latex having contact with you. But the allergic dermatitis, This happens after sensitization period. So, you know, after 6 to 48 hours after wearing the gloves, you may notice some fluid-filled vesicles, so blisters on your outer skin level. Now, the latex allergy type 1, this happens within a really short period, seconds to minutes after the exposure. Hives, edema, hypotension, tachycardia, wheezing, respiratory distress, laryngeal and bronchial spasms, and then circulatory collapse. So this could be a very fatal reaction. Now, here's some items that are used in surgery that contain latex that you may have not thought about. So your asepto syringe, your bulb, a lot of catheters, tubing, the disposable face mask, the S-mark bandage that's used, oral airways, gloves, both sterile and non-sterile, your stopcocks, syringes, tapes, tubing, urinary catheters, different types of tourniquets, wound drainage devices, and your Yonkers suction tubing. So you can see why a patient that has a latex allergy is going to be used first in the case. Everything's going to be non-latex that possibly can. I know that in our lab, you've seen some stainless steel Yonkers. That's for that type of a patient. So things are going to be managed as well as possible to accommodate that. Come on. Okay. I don't think that was the last one, but maybe it was. All right, let me stop and share a minute. Hold on a minute, my computer has. The PowerPoint decided to stop working. All right, let me look. Okay, let me just, while that is trying to figure itself out, resume slideshow. Sorry, PowerPoint has just, this PowerPoint is going off grid. So let me get back over here. Let me just share my screen and go to the book. And we'll just look at the book, because I know there were a few more things I wanted to talk about. Okay. So let's talk about chemical hazards. You know, there's a lot of things that we want to make sure that we are protecting the patient and ourselves from in the OR. So remember, we talked a little bit about your ESU plumes. So those surgical plumes, they can be a concern with that. What we have are, let me see if it's ready to play. Sorry, it said no. We have what's called a surgical evacuation system that helps to remove the remove that exhaust from the environment. So just to help with a lot of these chemical exposures that we have glutaraldehyde, ethylene oxide, formalin, PMMA. So a lot of these are used in the OR setting. So like the PMMA is used in bone in ortho cases for like as bone cement. And so when these are being used, you're exposing the patient and yourself, the entire staff, to some of these chemicals. So ORs have, like I said, those HEPA filters. They also have vacuum systems for the surgical plume. I was looking to see if they have a picture in here, and no, they do not. I had a really good one in the in the PowerPoint, but it's still not wanting to work. So what I'll do is I will release this PowerPoint to you as soon as it allows me to, so that you can have that to go along with. And I think that was pretty much all that I had. Let me double check. I'll include, it'll be later before I get this loaded because it is a little locked up, but luckily we were at the end of that. So being able to see the surgical plume. One other thing that I did want to talk about though is the neutral zone. And I just had a picture of that for you to see what the neutral zone looked like. So this is an area to eliminate the sharps contaminant, you know, the risk for you to be stuck by a sharps, or your surgeon be stuck by a sharps. And so having that neutral zone area is a way to like really eliminate that risk. So with the PowerPoint freezing up, that is about all I have. There was only about 3 slides left anyway. So, well, actually looked like there was about 5. But yeah, I think, you know, you guys will be in good shape with what we've got so far. If I get into the PowerPoint and I see anything that definitely needs addressed, I will do another quick video for you and add that to it. I'll get this loaded for you guys as soon as possible. I forgot to insert your keyword. So here we are right at the end. So let me look around the room and see. I forgot to have my words ready. So I am looking at my daughter's decor in here, and she has a large one, and it says a lot of little words, and then it says stay a while. So stay a while is your only keyword that you have to remember. And here it is right at the end. And also just let me know that you saw that my PowerPoint went wonky, and it still is. It's white. It won't even pull up. So I apologize for the technical difficulties that happened there. And like I said, once it does let me access it and I can see that there's anything additional we need, I'll post the short video on that too. Hope you guys enjoy this. Let me know if you have any questions. Have a great day.